Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I am here on the very first podcast of 2021 with Dr. J. Calvert.
Good to see you, Millicent.
Always a pleasure.
Happy to be here to start off the new year with a new approach to the podcast.
Yes, we have some interesting ideas up our sleeves, which we are very excited to bring.
Yeah, I think today we'll just talk about the new year and the new you, but I think we're going to do a whole new approach to this podcast and really start pushing it towards a video podcast.
Right, that would be the idea, something that we can really put out on various platforms, really as an education tool is sort of how we're looking at it.
Yeah, I did my sort of first Instagram post today thinking about what I wanted to accomplish this year, and education is kind of what I think needs to really be forwarded through our podcast, through our patient education materials, through any of our social media. I really want education about plastic surgery, what it is, how to approach it, and how to get great results. That's the focus.
And I think that it is especially critical right now because there is a wealth of information out there, and much of it is disinformation, especially when it comes to plastic surgery, because the rumors and the fallacies and just the plain out lies and marketing that happens in plastic surgery is terrifying. And we can certainly link other podcasts we've done, on like board certification in plastic surgery and various things like that. But yes, the idea of these podcasts is to inform other plastic surgeons as well as mainly the listeners,
of course,
the prospective patients on legitimate plastic surgery.
It's hard to discern what is the true information, if there is such a thing. My patient was just here, and she had a deep plane facelift, and she was at 2-3 weeks after surgery marveling at how great she looks. And her kids said it, and her, one of the folks around town said it, and she kind of said, my friends who've had facelifts don't look like this ever. And I said, that's because they didn't have this type of facelift. And that's a problem when information just gets lumped into baskets. Just because Botox gets sold in units doesn't mean that Botox is delivered the same way. No,
not at all. And we have another podcast we can link to about that as well. Yeah, there's a lot to know about plastic surgery, and certainly, you could go down a deep rabbit hole on any given topic or subject. But hopefully, some of these podcasts will just be helpful to get the basics and the foundation of any given procedure. And then you can start to really ask, the informed questions based on what you hear.
Well, since it is a new year and we think you should work on a new you, what would be your approach? If you were just sitting there thinking to yourself, this year I want to be better looking on December 31st than I am today on January 1st or 2nd, whatever we are now. If you want to really look over the year, how would you, as a consumer of plastic surgery services, products, and surgery, how would you approach the year?
So that's an excellent question. New year, new you. Blah, I hate that expression, but it's very fitting for what we're doing right now. And I think that we have to look at this particular new year, new you moment of time through the lens of COVID-19, because we are definitely very much still dealing with that. And so that puts a little bit of an extra spin on what you can and can't do. Not can't do, but what you can do, I guess, is a better way of saying it. So we mentioned this briefly before, but a lot of people are staying home right now. They're still not going into the office. They're working from home. Here in California, we still have mask mandates. Everyone has to wear a mask everywhere they go. So this is really the time to, I would say, start focusing on your skin. So much of what we can do as plastic surgeons predicates on the fact that you start with good skin.
100%.
Because you can do your amazing deep plane facelift, but if the skin that you're moving is dry, dull, cracked, it's not going to look near as fantastic. So now is the time. It's winter, you're not getting as much sun, you're staying at home because of COVID. Do those procedures that require some downtime for your skin. So that's going to be the lasers, it's going to be the photofacials. These are the things that I would probably start focusing on in these beginning months.
What about if you're planning to have surgery in the pandemic, which a lot of people are, by the way.
A lot of people are.
Specifically for the reasons I think we've talked about before, the fact that they're stuck at home, they can't travel.
Stuck at home.
Not spending a lot of money on anything anyway. And so the people that are able to, muster the funds and the time and the effort to do this are doing it because
now's the time.
You're wearing a mask, you're doing, you don't have the ability to go into the office, so you're working from home. All those things have led to, an uptick in sort of facial aesthetic procedures for me, for sure. But even the body procedures too. People are doing it because they can't go anywhere.
They have the time to recover. They're not making those big trips, the vacation trips to Europe or cross country or wherever they were going to go before. So they have the time and the resources.
Yeah, I mean, you have that sort of kind of push to like, this is probably the time to do it.
This is the time.
If I was going to get a facelift, looks like we should do it.
Right. And so that would be the next thing I would be looking at. If you have any kind of facial procedures, facelifts, rhinoplasty, brow lift, I would start looking at that in the beginning of this year as well. I would put the emphasis on the skin, give a good 6 to 8 weeks of getting your skin in top shape, and then start transitioning to doing your facelifts, rhinoplasty, face procedures that, again, you can sort of stay home and hide for a little bit while you're recovering.
For sure. And of course, there's always the ultimate excuse. I might have COVID, and then nobody wants to see it.
10 days. I
just need to figure it out.
I'm not sure. I was exposed, so I'm just going to be safe. I'm just going to stay at home.
I wouldn't use that excuse, actually. People get pretty freaked out. But I have had people who've done that, I'm pretty sure. I'm pretty sure they have. And that's not a good excuse because, COVID, it's bizarre to me, just on a side note, it's bizarre to me who gets really sick from COVID-19 and who gets like the sniffles. It makes no sense.
It's a very odd virus. It doesn't follow the rules.
No. That is where I think that there has to be some sort of predisposition to the disaster version of this disease. Something genetic that we don't know about yet. That we'll find out. It'll come around. You'll find out that people with this genetic makeup are the ones that when they get this, and this is why, because it sets off this or sets off that. I don't know, it's just, it's bizarre to me. But I mean, the bulk of the people that I know who've gotten COVID-19 have had the sniffles, the headache, a little bit of fever, kind of a sore throat, felt crappy for a day or two. I've only had a few people that have gotten really sick, and they were people that were in age ranges and with disease problems that would have said that the flu would have been dangerous for them.
Right. There's a certain cohort of people certainly that are expected to do worse no matter what. But we digress.
Yes. So back to what to do this year. Because I
other than don't get COVID.
Other than don't get COVID, which you really should. You should avoid this at all costs. By the way, like a lot of people are finding out that they've had it already.
Kind of impossible right
It's
now.
impossible. It's a pandemic. People don't understand the word pandemic means like you're getting it, like just wait your turn, it's coming.
I know, I have my friends that are like perseverating. How could I have gotten this? Where did I get it from? I'm like,
pandemic.
you're never going to know. You're literally never going to know.
That is the definition of pandemic. You're going to get it.
Yeah.
You do everything you can to try to avoid it, but
there it is.
It's going to happen. I mean, that's how these diseases work, and the sooner this thing gets taken out, the better.
But anyways,
I got to say, in terms of what to do now, and once again, I will mention that as a luminary for all my lasers, I am loving this Opus machine.
The Opus machine's pretty awesome.
It's insane.
Yeah.
It is tightening, it's microneedling, it's shrinking skin, it's resurfacing. It is a skin treatment that is totally new and different. I would have had to combine 3 modalities before to do what this does in one, and the results have been crazy. We're really loving it.
So when are you getting yours?
February.
Mr.
I'm all
New
set
Year,
up.
New
I know.
You.
I'm definitely doing that.
Speaking of.
Not only am I doing that, I'm thinking about some other stuff too. I can't stand what's happening in my face. It is like falling apart in front of my face. It's terrible.
I don't know, you got your Botox touch-up. You're looking pretty nice.
The Botox is good. Thanks.
That's
Yeah,
good.
Kyra nailed that for me. I just couldn't take it anymore. I was like, you have to. I made her come in on Thursday on New Year's Eve to do my
It's emergency.
I mean, I used it as like there was a patient that was coming in. I needed assistance, but I really needed her to inject me. It was awful. It was getting worse by the minute. So. Hey, Dr. J. Calvert here. I'm very happy with my Botox. This is the follow-up. Kyra, nice work. Thank you.
You're welcome.
So what did you do exactly?
We touched on his proceras across the corrugators, where we have those frown lines, 20 units, 16 across the forehead for the frontalis, 12 to each of the orbicularis around the eye to knock out those lines and those crow's feet.
I like it because I still have movement and I still have some wrinkles, but I don't look like
harsh.
Like frozen like a mannequin, which I really don't like.
Yeah.
Well, thanks. Very good job. Thank you, Kyra, for the emergency Botox. But yeah, I mean, that's the thing is that Opus is a great way to go. There's, just doing straight resurfacing is key. My feeling is, and my two major league injectors and laser folks, Kyra and Orla, they're feeling like if you're going to do resurfacing, why not do the Opus? Because you're getting the shrinking of the skin with the radio frequency too.
Yeah, I would agree. I'm probably going to be doing some of my own resurfacing the next few months. And then that brings us sort of, to the spring and summer months, which is typically in any given year when we see our increase in the breast and body procedures. Everyone's getting ready for summer, they're shedding their winter skin, their winter body, and they're like, oh my gosh, where do these extra pounds come from?
Especially
Lipo and
now,
breast
right?
implants. Breast implants and lipo are the rage in April.
It's like, it is all we do. You gotta get an extra lipo machine because it's just going so much. But I mean, it's true. It's like you get your implants, you get your liposuction, your tummy tuck, whatever.
Like a good 6 weeks. I tell patients 6 weeks before you really plan on getting out there in your bikini and going on vacations, give it a good 6 weeks because you need at least that. Sometimes it's even a little bit more if there's a hiccup or something happens. So at least 6 weeks before you plan on doing any kind of bikini showcases. And hopefully by this summer, things will be starting to turn around from a COVID standpoint. The vaccine will be starting to kick in a little bit more. So hopefully some of these restrictions we have in place will be letting up, and you can go to the beach, go to amusement parks, go on vacations, show off your new body type things.
I think that is fair advice. I mean, it is that March-April axis that is like the key time to do all those lipo, tummy tuck, breast procedures. It just is. People feel it. They finish up winter and they're like,
now it's time.
I gotta do something about this. It's like, the gym can do so much, but if you really want to make a change, that liposuction, especially, love my laser lipo, but doing all the things, the diet, the exercise, focusing on that. But really, with the procedure, you can make a massive change.
Amazing. So if you're even at all thinking about doing something mainly breast and body, coming up in the spring or summer, you really want to be at your goal weight. So whatever that is for you. And you have to be realistic about it. Because I have some patients that are like, oh, I really want to do this, but I want to lose 30 more pounds. I'm like, that's great if that's realistic. If
in your dreams.
That sounds amazing.
Give me a break.
But maybe 10 is a realistic goal, and that's your natural healthy body weight. So if you are eating right and exercising regularly, and that's just your healthy weight, then perfect. Let's go on and do the liposuction. But really, you want to sort of put in the time and effort, these next few months to really get at whatever your healthy goal weight is, and then you'll be a good candidate for your tummy tuck, your liposuction, whatever it might be. And then certainly going into the summer months, that's when I definitely see a lot of my students coming in for things. So that's the rhinoplasties. I see a lot of breast reductions in college students around that time. So it's the kids that have a break from school to do some of these bigger recovery procedures. I do see an uptick in that in the summertime as well.
Yeah, like May, June, and the first 2 weeks of July. Basically, July 18th was sort of the day that everything. I just do so much rhinoplasty. It's insane.
Yeah, you have the same thing.
It is rhino pandemic in that period. It's like nuts, but it's good. I mean, I
It's
love
good.
it. I love doing, I do 5, 6 a week, maybe more sometimes, but that's kind of the key time, and it's really fun. It's
It
just,
is.
I love it. I love doing rhinoplasty, and the results for the kids are just amazing. And it's not just the kids. It's like, people always say, what's the youngest you'll do a rhinoplasty? Well, it's really when the teenager is mature enough to ask for the rhinoplasty, can articulate what they want, and their facial growth is pretty much
It has to be
finished.
stopped.
Yeah.
Girls, that's 15-ish.
I think so.
Boys, 17, 18.
17, 18 for the
Yeah,
boys. I mean,
at least.
I don't like to do 16-year-old boy
No.
rhinoplasty because their face is going to change so much.
So much.
But if their hump is just like egregious and angry, and then I have
And it's
to,
causing
I have
them
to step
problems.
in.
Then we can
Then
do
you have
it
to step in.
with the caveat
You
you
may have to
may
do it
need
again,
another one
for
because it may
sure.
grow back.
But I mean, there are some that are just, you have to help. You can't leave it that way. It's not nice. One other thing about the new year, new you. How does one go about making a plan? Do they come in for a consultation? Do they, do some reading online? Do they, what's the best way to kind of, because I always make the argument that if you go to, you go to your doctor, you go to the dentist, you have certain things that you do regularly, that aesthetic should be one of those things that you do regularly so that you can always look your best. Because people get, incredible boosts in confidence when they look their best.
Yeah.
It is not subtle in terms of their confidence and their attitude when they feel, I feel better having this Botox in my head. It's a small thing, but, already it's like, it looks better. I don't look as shaggy and droopy of an old guy that I am with the Botox on board. It's a very noticeable change. So for somebody that's sitting there wondering, how do you even start to approach it? I agree with you, start with your skin and work in from there, but who directs them? Do they call the rock spa? Do they call you? Do they come in? What do you think is the best way to go about it?
Number one, you listen to this podcast.
Well, the podcast is key.
Obviously.
You binge the entire thing. You want to learn about plastic surgery, it's here. We get it.
But in seriousness, I think going to your plastic surgeon with that specific request, because you can certainly go to your plastic surgeon and just say, well, what do you think? And you might get like a shotgun approach of like things that they would love to do for you, but they might not understand what you're trying to ask. So you have to go and specifically say, I want a timeline of ways to look my best. How do I start? At every plastic surgeon's office, it's going to be set up differently. Here we have
sure.
the rock spa. So if it's, you want to start with your skin, I would tell you everything I know, but then I'd probably direct you to Orla, who could really line up a specific plan and timeline for all of her procedures. And then some plastic surgeons' offices, they do it themselves. They don't have anything, so they may offer you different paths. But I would go and specifically tell your plastic surgeon, I'm looking for a timeline for this year, for the next 6 months, and work it out. It's not an unreasonable request, and your plastic surgeon would probably love it. Like someone who's on board and dedicated, kidding me? Love that.
Yeah, you got to have a plan for it, because you can't just do a little Botox here and a little filler there and think it's going to all come together and look amazing.
No,
there is a comprehensive approach, and you got to have that. And you got to work with a plastic surgeon in an office that thinks that way too, because some offices is just like, we do rhinoplasty here, that's it. Anything else, go somewhere else. We sort of have a one-stop shop, and we have different people that do different things. So it's not all of everything coming from one person, and that is also important, because how could you possibly be focused on everything and be good at everything? It's just like if I want lasers, I'm having Orla do it. I'm having Kyra do it. They do lasers all day long.
I agree.
All the time. That's what they do. They do injectables. I don't know that I could really do a great Opus treatment at this point. It's a new machine. I've used it a couple of times and I can do it. But I would defer to Kyra and Orla, who are already doing tons of it.
That's what they do. We do surgery. They are the experts at the non-invasives and the non-injectables, and I'm totally comfortable with that. That's perfect.
It is.
You need someone who's dedicated to that, and what they do all day is that.
For sure.
So, I'm on board with that.
So basically, you gotta call up and come in here.
think of it as a difference between if you have a trainer which would be nice. I'd love to have a trainer. But a trainer would give you like a plan, right?
Sure.
So today we're doing cardio, tomorrow we're doing Pilates, the next day we're doing this. And they have a plan for you and for your body and for your whole routine versus like what I'm doing right now. Oh, today I'm going to do some yoga on YouTube. Tomorrow I'm going to go for I don't know, I'm tired. I'm not going to do anything today. Like
I'll have some of this chocolate
piecemealing
cake,
it.
actually,
Yeah.
instead.
Whereas when you have a trainer, think of that plastic surgeon as your trainer.
Your
Someone
aesthetics trainer.
who is going to like keep you in line and have a time schedule for you and a plan because they know the whole comprehensive system.
Well, if I'm a aesthetics trainer, I'm gonna have to get some abs. Because those trainers on Instagram, they have abs. They've got abs like you know what though? That's their job. So if that were my job, I still wouldn't have abs. It's just not possible. Those guys are ridiculous. But good for them. So yeah, that's it. Get yourself an aesthetics trainer. Get a plan for the year, and have a lot of fun. So since you brought us in, you should bring us out on this one, Dr. Rovelo.
Well, thank you for listening. Thank you to all of our listeners. This is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.